And people are flocking to these things right now because all the gyms are closed. So I've also talked to friends who are now taking the opportunity to maybe learn an instrument, play the guitar, learn that for the first time, or piano, things like that. Read a book that you haven't read or wanted to read that somebody has recommended to you. So all sorts of things in ways that people are sort of whiling away the time. It's KCRW. It's 4 o'clock.
In war and in case of a natural disaster or an epidemic, we are the surge force.
How is the country's largest healthcare system preparing for the coronavirus?
VA Secretary Robert Wilkie tells us his department is ready.
It is Thursday, March 19th, and this is All Things Considered from NPR News. I'm Mary Louise Kelly.
And I'm Elsa Chang. Ahead this hour, the coronavirus was slow to show up in Africa. Now an entire continent is bracing.
If we learn from the history that we have seen in all the other countries, I think we are in for a big shock.
Also, keeping your kids entertained during the coronavirus shutdown.
I was thinking, oh my gosh, everyone's going to be home. We need a project. And I went online and I ordered 20 chickens.
20 chickens! That plus Bob Mondello has some picks for movies to nest to while we're all staying at home.
That's ahead after the news.
Live from NPR News in Washington, I'm Jack Spear. Senate Majority Leader Mitch McConnell is releasing a broad stimulus bill to aid in the ongoing response to the coronavirus crisis. NPR's Kelsey Snell reports Republicans are now briefing Democrats on the proposal.
McConnell worked with Treasury Secretary Steven Mnuchin and several GOP committee chairs in the Senate. The bill includes cash payments of up to $1,200 per person. Those payments would phase out for individuals making over $75,000 and couples earning over $150,000. Taxpayers with children would be eligible for $500 per child.
To calling on Americans not to travel, it's also urging those Americans who are abroad to return home as they plan to remain overseas for what officials are calling an indefinite period. Prior to this latest statement, U.S. citizens were being told to reconsider international travel. This warning raises the guidance to global level 4. Something unprecedented in terms of such State Department advisories. Researchers in Europe say they are seeing new clues about how coronavirus can spread so rapidly. NPR's Jeff Bromfield reports on further evidence transmission by infected persons who seem perfectly healthy may be a bigger factor than previously thought.
After several people turned up infected with coronavirus in the Netherlands, researchers tested numerous healthcare workers and found a number of them had high levels of virus despite having only mild symptoms. Marion Koopmans is with Erasmus University in Rotterdam.
We see very rapid, very high levels of virus in the nose and in the throat.
So the infected could transmit the virus even if they didn't have serious symptoms, Koopmans says. There's also evidence that some people, especially children and young adults, may never show symptoms. Taken together, the findings suggest a significant number of apparently healthy people can spread coronavirus, and that could help explain why the disease is now sweeping around the world. Jeff Brumfield, NPR News, Washington.
The Federal Reserve has set up a program to exchange dollars for foreign currencies with 9 central banks. Part of an effort to support dollar lending in global markets that are coming under increasing pressure from the impact of the coronavirus pandemic. Stocks closed modestly higher today. The Dow up 188 points. The Nasdaq rose 160 points today. You're listening to
Health. She says the overall number of cases in the county has increased by at least 40 today, plus 2 more cases reported by Long Beach officials. She said the person who died was between the age of 30 and 50 and had an unspecified underlying health condition. Ferrer said the total number of confirmed cases in LA County now at least 230. She stressed that the county is going to see continued increases in cases over the next 4 to 12 weeks because of more frequent testing. Economists say California workers in the service sector and gig economy will be hurt the most by the coronavirus. Millions of Californians are now working from home, but many others, restaurant workers, hairstylists, rideshare drivers, they don't have that option. Here's Sacramento State economics professor Sanjay Varshney.
These folks depend on their jobs where they're actually directly servicing the clients. So those workers, in my opinion, are much more vulnerable.
The California Restaurant Association estimates nearly 2 million people work in restaurant and food service jobs in the state. Uber and Lyft say they have hundreds of thousands of drivers statewide. Evelyn Williams is one of them. She uses the income to support herself and her 2 sons, but with rides drying up, Williams says she could soon be without a home.
There aren't any other avenues for me. I've reached out to the homeless shelters. I've reached out to the Department of Public Health, the Department of Human Services.
If your employer has reduced your hours or shut down due to COVID-19, you can apply for financial assistance through the state's Employment Development Department. And a bone-dry February finally giving way to some much-needed snow. Here's KCRW's Jonathan Bastian.
As of today, more than 60 inches of snow has fallen on the state's highest peaks. The storms have also brought 100-mile-per-hour winds, whiteout conditions, and road closures. And while a major dump like this would have been reason to grab your gear and drive north, think again. The major resorts like Squaw and Mammoth have
LLP, with offices in the U.S., Europe, and Asia, Cooley advises entrepreneurs, investors, financial institutions, and established companies around the world where innovation meets the law. It's 4:06.
From NPR News, this is All Things Considered. I'm Mary Louise Kelly in Washington.
And I'm Elsa Chang in Culver City, California. Cases of the coronavirus have now topped 10,000 in the U.S. The U.S. State Department today issued an advisory warning Americans against travel abroad. President Trump announced he's mobilizing FEMA to help with the administration's response.
And then there are the hospitals preparing for an onslaught of patients, prompting the question, how is the largest healthcare system in the country preparing? Well, that would be the Department of Veterans Affairs, and joining me now is its leader, Veterans Affairs Secretary Robert Wilkie. Secretary, welcome.
Well, thank you. Thank you very much for having me.
So let's talk about the network of hospitals that the VA runs, which are, of course, there to serve the country's 19 million or so veterans, of whom a big proportion, something like 6 million, are elderly, which is the population most at risk here. Are you prepared to treat a potential onslaught of sick new patients?
Well, we are. We are an institution that has 170 hospitals and 135 community living centers. We have been preparing for what was coming for a while now.
What changes have you already made?
Well, we were the first health system to actually stop people from entering our facilities without being questioned or tested. We were the first healthcare system to actually curtail, and sadly we had to curtail, visitors to our community living centers where we have 7,800 veterans who are in acute distress, usually veterans of World War II and Korea, some from Vietnam. And we had to take the hard decision of keeping their relatives and friends out. And then we also stopped elective surgery. We stopped elective surgery a while ago to free up thousands of beds within our system. We have a capacity on a normal day of 12,500, but we're going to increase that.
How do you increase that? Is this new facilities, more beds, what?
Yes, we use every available space that we have. Actually, before there was any hint of a national emergency, I freed up our newest facility.